My name is Michelle Hudson. I'm a physical therapist from Bonner Springs, Kansas. My story started several years ago. I was a former college softball player, which led to some problems with my shoulder. I've had 7 previous shoulder surgeries, none of which fixed the problem. It was getting to the point I couldn't do my job anymore, which I'm very passionate about. I love being a physical therapist, but I couldn't take care of my patients. I was getting pretty desperate. I was actually looking for physicians across the country, at Mayo, at Boston. That led me to start to look here in the Kansas City area for options as well, which is what led me to Dr. Daggett. When I made the appointment, I made it clear that, I wasn't just going to come in if I was just going to get 10 to 15 minutes and nobody was going to take the time to listen to what I had been through. And that first appointment, they had blocked out like 45 minutes to spend time with me, and they spent that whole amount of time just listening to what I had been through.
Michelle's had a very complex situation. She's had 7 previous shoulder surgeries. She's also very educated. She's a physical therapist and has known that her shoulder hasn't been right for quite some time. The diagnosis is the most important part of any revision situation because it really dictates what treatment options we have. And that's why it's so important to differentiate pain from first, second, third surgery versus the actual cause of her disease. Once we got the diagnosis right, which was done by physical exam and imaging, it was pretty clear-cut options going forward for her treatment. The most important part is to make sure you individualize your treatment for a patient and that you're not just treating kind of a generic syndrome, that you're actually focusing on what their diagnosis is. And I think that kind of individualized approach that we take here really resonates and allows us to get the outcomes that we seek.
Before, I felt like nobody was really listening, and he did. He had made one statement that really kind of resonated with me. He had told me that one of his mentors had said that if you listen to the patient, they'll tell you what's wrong. And that was big to me. I felt like somebody was listening to what I had to say instead of just listening to respond. He listened to hear what I was saying. The day of my surgery, everybody from the person I met at registration all the way to the nurses, the anesthesiologist, everybody was very kind, and it was a great experience. And I've been in healthcare long enough to know that type of care starts with leadership. It starts with people loving to go to work, loving to be where they're at in the morning. So it was a great experience. My recovery is going well. I've had 8 surgeries, so it's going to be a hard road. But for the first time in a long time, I feel really positive about where it's headed.